Hello, and welcome everyone to Heart of the Matter, a broadcast series where survivors come on and share their stories, inspiring us to live the healthiest lives we can. I want to remind everyone that heart disease is the #1 killer of women, taking the lives of 1 in 4. 48 million women in the United States have some form of heart disease. I give you these statistics because my guest today is a heart survivor. I'm going to tell you a little bit about her before I ask her to come on and answer questions and tell her story. It's such an honor for me today to have my friend and heart sister, Michele Abrahams. I have to confess that I met Michele when I very first started Women Heart in Astoria, Oregon, and she runs a support group there and has for 7 or 8 years. So let me introduce Michele and tell you a little bit about her. Michele is married and a mother of 2 beautiful daughters, 30 and 23 years old. This April, she's going to be a grandma for the first time. Her heart story started at birth. You're going to hear that in a minute. She trained at Women Heart at Mayo Clinic in 2013 and started running the support group in Astoria, Oregon in 2014. Not only does she volunteer for Women Heart, but she's an accomplished bookkeeper there in Astoria. In her free time, she enjoys time with family and daily walks with her dog, Sky. Won't you help me welcome Michele Abrahams? Hi, Michele.
Hi, Susan. Thanks for having me today.
You're welcome. I'm so pleased to have you. And your heart story is one that I want everyone to hear. It's very inspiring and compelling. So, will you tell us your heart story before we answer questions?
Sure, I'd be happy to. My heart story, she wasn't in that bio, is that I'm 54 years old, just turned 54 day after Christmas. And my heart story started 54 years ago. I was born with a congenital heart disease called transposition of the great arteries, and they did not know it prior to my birth and actually sent me home. My parents did not know that there was a problem either and sent me home, and thought everything was fine until my grandmother noticed that the bottom of my feet were black, or towards black, really deep blue. And so they brought me to the doctor again that actually delivered me. And he said, "Oh, I hear a murmur." And so he sent my parents in their car with an oxygen tank and me, and sent me to OHSU. He had called ahead and told them that they were coming. And so sent me up there with them, and they did my first surgery in January. I was born in 1966, and they did my first surgery about 2.5 weeks later in January 1967, which is a surgery where they increase the hole in your heart and make it so that the blood can circulate as it should, or more like it should. And then basically gave me medications to keep that hole open and sent me back home, and decided that they would do the repair surgery a few years later down the road, which they did in 1970. So I was almost 4 years old when I had my repair surgery, as they call it, the mustard procedure, done at Dornbecker OHSU. Dr. Starr, who's a well-known cardiologist, I believe nationally, but for sure in the Pacific Northwest, was also in on the performing of my heart surgery. And I thrived after that. Basically have lived a normal life, other than I do get winded, and so I am unable to exercise as much as most people do. Gym class during school time was a little harder for me. Everybody was to run a mile. I was lucky if I could run one time around the track. And this is just something that I've learned to live with, which is fortunate but unfortunate, because it does put makes things difficult, but that is the importance of continuing to exercise so that you can keep your heart muscle going. Anyway, so I survived that. Have had two children, which they also were not keen on me having children, because as most women do know, that childbirth does put pressure on your heart, makes more blood flowing through your body. But I survived fine with both of them, other than I was in atrial fib when I delivered my second child and was cardioverted the day after. And so it has not been without complications. I have had two ablations to try and correct the atrial fib, and neither of those have worked. I do take medications regularly. Um, so it's been kind of a lifelong. I have had cardiac catheterizations. I have had a stent put in the baffle that was created with my mustard procedure. Started narrowing with my pacemaker. I'm on my sixth pacemaker. I've had a pacemaker since the age of 19. Um, so mine has been truly a heart survivor story my entire life. Um, but it gives me knowledge and it gives me empathy for women that have gone through this. I know Susan is more recent into learning her heart story and her heart journey of survivorship. But it's benefited me to become a women heart champion and a support network coordinator, because I have had echoes every year. I've had, like I said, cardiac catheterizations. I have had ablations. I've taken a couple different medications. I know once I've been allergic to one, so it did not work for me. And the biggest thing that I have learned is to be an advocate for myself. My mother always went with me when I was younger to the doctor. As I got older, I started going by myself, and she started getting a little irritated that she didn't get to go and hear what they had to say too. But I think around 30 something, I finally said, Mom, I kind of could go by myself. It's okay. So I've been lucky to be monitored and doctored by the same facility my entire life and have had some wonderful doctors. I've also had some that we do not see eye to eye. And so I've had to change doctors due to that. But it's just been a life journey. And for me, I don't know any different. I wouldn't know what it would be like to have a healthy heart. But I know that my heart has gotten stronger based on my walking and choices that I've made in my life. I learned so much being part of Women Heart. Education is so important. And I am going to be a grandma for the first time, and we're very thankful for that. And also thankful that we have found out that he does not, it's a boy, that he does not seem to have any problems with his heart, because they did do a fetal echo on him in utero. And so we're looking forward to having a heart healthy baby grandson.
Oh, that's so wonderful.
It
So,
is wonderful.
yeah, so I'm curious. So this particular condition that you have is genetic? I mean, you got
They
it from
don't
someone.
know. See, that's the problem, because there's nothing that has shown signs in our past family history. So when I became pregnant, I was told that I had a 5% chance of having a child with some form of congenital heart disease, not necessarily the same form as I have, but some form of congenital heart disease.
I
And
see.
so, but you have to remember that I am probably one of the oldest or older on the older end survivorship of transposition. So the doctors really do not know. They don't, it's all based on research. So when I was pregnant with my first child, she was actually in utero and after birth part of a research done at OHSU on women with congenital heart disease that have babies.
Wow.
So she is in the textbooks as long as alongside me, um, as educational purposes for the doctors, so that they can know
Right.
know what to expect
I
down.
guess that's something to be congratulated on, although to be the longest, one of the older ones, my goodness. So I'm curious, two things. You've said this before, and I've never really known what it is. Your first fix, if you will, you call it a mustard procedure. Why do you call it that?
It's the name of the doctor that invented it, and the
Oh,
procedure actually is where nowadays with the transposition they actually switch the arteries back to the way that they should be, a
um,
normal heart. So basically what happened with my heart is that the the aortic artery runs, and it was just bringing the blood from my lungs to my heart back to my lungs. It was not mixing like your blood normally does in your chambers. And so they have created a baffle, which is what this mustard procedure is
I see.
creating a baffle in between the chambers so that your blood actually will redirect, so it goes from your aortic side to your pulmonary side. So
I
actually
see.
what it is that so a normal person, their left ventricle, the lower left chamber, is what pumps your blood out to your body, and your heart is created so that that ventricle is bigger and stronger to do so. My right one is what pumps the blood to my body. So that is the reason why I get more winded, because it's just not designed to do that.
I see. Okay, thank you for explaining that.
Sure.
So also, you mentioned that you've had AFib since during pregnancy and delivery and have had ablations for that. Was the AFib caused by your heart condition?
Well, tachycardia is caused by the heart condition I have, and having the mustard procedure done, which I've always had tachycardia, which is a fast heart rate.
Right,
AFib is where the sinus node, the pacemaker, if you will, to your heart, is not relaying the messages to your lower chambers as it should.
right.
And so the AFib, who I could have developed it not ever being pregnant, we won't know. We
Okay,
just know that it seemed to come on at the very end of my pregnancy with my second child,
okay. All
and
right.
the time it was detected.
All right. Well, that's just something, and you're right. Having it your whole life, no other way of being. So some of the questions that I've been asking women have to do with things they did or felt after diagnosis. You were a baby when you were diagnosed. I mean, you've lived with this your whole life. So let me try to phrase it so it suits you. I'm curious to know how your emotions are. Do you feel an emotional reaction sometimes just because you have this particular type of heart disease?
I would say yes. Uh,
Tell me.
just like everybody else, I go through times of feeling depressed, feeling anxious. For me, it's always kind of been things go along and they go along good, and then all of a sudden something else will happen. And I think also the anxiousness, because being one of the older mustard procedure survivors, um, they don't know. I have been told for several years that there may be a chance that I will need a heart transplant by the time I'm 70. I'm
Mm,
54 now, so 70 isn't that far away
no,
anymore.
it's not. So
And so, but it's something that I don't know, and they don't know. And
right,
so for me, if going along kind of the same, those are really good days. Those are really good days. And appointment wise, those are really good appointments. But it's when something little comes up or something big comes up is when it gets a little more scary, because they don't know. They have no clue. They can only go by what they know to treat whatever is happening. But to treat it with a person with a normal heart may go fine. To treat it with a person whose heart is still technically backwards, it's gets a little more tricky. which is why the stent was placed. Because with the pacemaker wires, they were creating um, creating narrowing in that space of the baffle, and so the stent was put in when they took out my old wires and put in new wires. They put a stent so that that wouldn't happen anymore, so that the wires themselves wouldn't make the baffle narrow.
I was wondering about your stent because most people have it for a completely different reason. So let me ask you two more things. I often ask what lifestyle changes women made after their diagnosis. Again, you've had this your whole life. I know a little bit about you and your lifestyle. What lifestyle things do you practice that you think keep you healthy?
Well, I know for sure, as I've gotten older, that the looming possibility of having to have a heart transplant has really scared the bejesus out of me. And so I, at some point in time, decided that it was time to take. I've always been technically fit. I try and watch my weight, watch what I eat. But I know that alcohol plays a big part in AFib. And so I have changed that quite a bit over the last few years of not indulging very often, because I do know after having maybe two drinks, I do feel it. And so the other thing that I did about 3, 4 years ago is decide that I needed to change how I felt, and I started walking. So I
Mm,
walk for anywhere from 2.5 to 4.5, almost 5 miles, 5 days a week. Um, I got a dog. She's 3 years old, just over three, and that helped. I had a smaller dog before, and she didn't walk. But of course, I didn't start out walking 4.5 miles. I started out much slower. It
right,
was a great thing for me to walk up a hill. And by doing this, I had a couple of years ago, I had a stress test done. And by doing my walking, they were amazed when they did my stress test that I had a better outcome with my stress test this time than I had years prior. And they could not believe it, because technically, with a person as you get older, your heart function will diminish. It
right.
happens to everybody, but especially for me, that can happen. So therefore, they were amazed that I had changed the numbers, and that's good. So keeping my ejection fraction
Right.
is in is a big important thing, and the strong heart muscle is very important, and that's why I've changed and started exercising and know the
Wonderful.
importance of it.
Well, that's so encouraging to hear. So I'm going to wrap up with one last question, and that is, what advice would you give to women about themselves and heart health? Just one good piece of advice for them.
Um, I know it's been said because I've watched a few of your other little casts, podcasts, or whatever you're calling them. Um, I would say it would be the avocation of yourself. Like I had mentioned, there was a doctor that I did not see eye to eye to. He told me that the medication could not be making me feel that it was. And the nurse actually said, stop taking the medication and call me in a couple days. And I did. The headaches were gone. The nauseated feeling was gone. And and it just was, for me, it wasn't. So if I hadn't advocated for myself, I would have still been taking this medicine and feeling terrible. Um,
Right,
Honestly, I have gone back to that doctor years later, and we were on a much better page. Um,
right,
I think that's just kind of what you need to make sure that you are doing, is advocating for yourself and putting yourself first. It's
right.
taken a long time. I don't do it all the time, but I do put myself first. I walk also for my mental health, and I think that's an important thing to remember to do. Keeps the depression at bay.
All right. Those are really good pieces of advice. And I think that your doctor, when you went back and you were on a better page, he probably admired you for your advocacy and standing your ground. And I mean, doctors like it when patients know their bodies. I really believe that. So I'm going to wrap up for today. And Michelle, I thank you so much for being with me. And I enjoyed your story, and I know others will too, and your advice and your tips. And so I'm going to say goodbye for now. Michele, I'll talk to you a little bit right after this. And the rest of you, I'll see you next time on the next broadcast. Thanks very much. Bye-bye.